One of the most important conversations we're having today. Gareth, my partner in news, is out at Hani Baragwanath Hospital, ensuring that we understand, frontline healthcare workers, concerns, but also how they feel about alert level 1. Gareth, how's it looking from where you stand?
It's actually looking fantastic as far as an empty healthcare facility is concerned. You don't normally get to say that, do you, Toombs? When we talk about healthcare facilities, obviously it's not just providing good healthcare, it's also intentionally, ordinarily meant to be a profitable business, especially if it's private healthcare. But obviously this is very different here at Hani Baragwanath Academic Hospital. And the reason I say that is this is the COVID-19 facility. This was specifically built, and I might add, very, very quickly and very, very well put together in a short space of time. I'm actually going to be speaking to Dr. Naidu about this facility around 8:45 this morning. So that conversation coming up a bit later about how quickly this was put together. And it's not a white elephant. And I saw someone tweeting me earlier saying, what a waste of government money. It's now a white elephant. No, it's not. This is what you want. You do not want COVID-19 patients in these beds. It means the vaccinations are working. It means these masks. It means the social distancing. It means the hand sanitizer. It's all working because there are no patients in this ward. There are a few patients in one or two of the other wards, but the numbers are much lower. So before I run out of time again, I do want to bring in Dr. Lesley Bamford, Head of Vaccination Implementation at the Health Department, only because, Dr. Bamford, my apologies for earlier, we were talking about the Vuma vaccination campaign, and I ran a little out of time, but I want to just pick up on that again. You were telling me about the drive behind it. Just remind me what that is and when it's all taking place and what the call is.
So thank you. Good morning, and good morning to the viewers. A very simple and quick message. Vaccination sites across the country will be open over the weekend, particularly today and tomorrow, and many sites also on Sunday. There will be events across the country. There's been a call to action from the President calling people to come forward to be vaccinated, as well as from leaders across the spectrum, across the political spectrum, religious, traditional leaders, business, labour. So really just to urge people to come forward to be vaccinated.
And it really is such a quick process as well. I think it's gotten to the stage now, Doctor, briefly, if you don't mind, it's minutes. I mean, I think the longest part of your vaccination these days is that 15-minute wait.
Exactly. So our sites are open. People can register ahead of time, but if they aren't registered, they can come as walk-ins, they can be vaccinated. If they are registered, they don't need to wait for an SMS. They should come forward to a vaccination site. Any public sector or private sector site, people can come forward and be vaccinated.
And that's so important, especially if you haven't registered, because I think some people are still struggling with it. You don't need to. You can now just walk in. Dr. Bamford, thank you for staying for us to get all that info from you the second time around. Dr. Lesley Bamford, Head of Vaccination Implementation from the Health Department, about the vaccination campaign called Vuma. Go out. It's a good thing to do, and they're making it so easy. Also joining me this morning, and good to finally see you in person, Professor Rudo, Head of Critical Care here at Hani Baragwanath. Prof, it's so nice to see you in person. We normally talk over Zoom, and here I am standing with you. First of all, congratulations. I mean, this is quite the facility. I mean, how did this do during the hardest parts of the third wave? How did it go?
So this ABT structure was built specifically for COVID. And at the height of the third wave, we treated 2,000 patients in here. Those 2,000 patients would have been carried by the general Hani Baragwanath Academic Hospital. And you know, it was at the time that the Charlotte Mathivha Hospital was down after the fire. But let me tell you about how this Hani Baragwanath Hospital handled the COVID pandemic. As soon as we knew South Africa was going to be hit, we got together with hospital management, all the clinical heads of departments, and we worked on a strategy of repurposing wards for COVID. And we worked on a program to stop all elective work in the hospital. And as soon as the COVID patients started arriving, we had identified wards that would be COVID patients. We then repurposed a 37-bedded ward on the general hospital site and converted it into a COVID ICU. we equipped it as an ICU. By the way, the equipping of this unit was done by myself and Sister Pauline Tlale, because I'm chair of the equipment committee at Chris Hani. Pauline Tlale is my deputy chair.
And putting this together as quickly as you did, I mean, this is not sort of equipment that you found in the back storeroom in a spare part of Chris Hani. I mean, this is state-of-the-art equipment. I mean, just tell me how you were able to get this together so quickly, not just from the facility side, but from the equipment side. It's quite something.
So we had cooperation from the equipment companies. And obviously, if you're coming to buy in bulk, there's economies of scale. You can negotiate the price. They had the equipment already in the country, so we were able to procure that with the help of Gauteng Health. And we were able to equip, each bed here is actually equipped as an ICU bed. But this facility was reserved for mild to moderate COVID disease, but equipped this way so that if a patient crashed, they could be held here for 24 hours before they could be stepped up to the proper COVID ICU on the other side where they were intensivists.
How concerned are you about the fourth wave? The third wave, it seems we're saying goodbye to it now, Prof, the third wave. We're expecting that this fourth wave, I believe it's sometime around about December, early December. How concerned are you about the numbers we could expect?
I'm extremely concerned because we're still seeing variants of concern of the virus. We're going into a period where we're now going to have mass gatherings, and those are super spreader events. And post those mass gatherings, post the elections, then that's when we're going to see how much of an effect that has had on the virus being transmitted. Our vaccine penetration hasn't been that great at the moment. So I hope that people will take advantage of the Vuma weekend and go get vaccinated. And that being vaccinated, and if we get as many people vaccinated, that gives us another weapon in addition to social distancing, masking, and sanitizing your hands.
Because by getting the vaccine, I think there was a lot of confusion in the beginning, Prof. I'm sure you might agree that getting a vaccine was the same as a cure. It's not. Getting vaccinated stops you from ending up, or at least it lowers the chances of ending up in a facility like this. Is that my understanding correct?
That is true. The vaccine is not a cure. It reduces the chances of you getting severe disease and dying from COVID.
Let me ask you a question that I asked Professor Shabir Mahdi. I don't want to go into politics. I'm talking to a medical expert here. From a medical perspective, do you think lockdown level 1 is a good idea?
If I were the president, and I'm not, I would not have stepped us down right now. But I can see the factors that are at play that need to encourage movement of freedom. Going to elections, holding rallies, and we're heading into a festive season. There's a fine balancing act that is being played here. And I can understand the dilemma that the president is in.
I've got about 30 seconds left with you. I want to just leave you with the opportunity in those last 30 seconds to just tell me about your staff and how well they did in putting this together and keeping this going. Last 30 seconds.
Okay, so Bara treated around 15,000 COVID patients in the hospital, and then plus the 2,000 here. Our staff were run down. We have shortage of staff. They were run down, but they came out as the A-team. They worked, they got tired, they watched colleagues drop off by their side, they watched relatives drop off at home, but never on a single day did they say we're not pitching up for work. So, Bara is not the kind of hospital that blows its own trumpet. We just get on with the work. And we did very good. And it's reflected in our patient outcomes. Our ICU mortality rate was only 47%. So we pulled a lot of people with very serious critical illness from COVID through. And we are, after all, the largest hospital in the Southern Hemisphere, 3,200 beds.
And you see what a difference it has made as well to have a facility like this at such an incredibly large and well-respected hospital. Prof, thank you very much. Congratulations to you and your team. We know the fourth wave is coming. We're going to try, as South Africa, to try and limit the damage as much as possible. But thank you for your time in speaking to us this morning. Professor Rudo Mathivha, Head of Critical Care here at Chris Hani Baragwanath Academic Hospital. Around 8:45, Tumelo, we're going to be speaking to someone who knows a lot about the facility itself. It's very, very large, very impressive. We're going to unpack the facility itself at around 8:45 this morning.
All right, we'll be sure to come back to you, partner, when that time arrives. Thanks, Gareth.